Okay. Alrighty. Let's just make sure everything is okie dokie. And after everything is okie dokie, we will continue with the broadcast. All right, let's see. Looking good so far. Okay, let's see here. Yep, looks good. All right, let's see. It looks pretty good. No issues, no bugs. All right, I think we're good to go. Let me just share this real quick on the old Twitter, the X, whatever. And then we will continue the show, Almost there. Okay, here we go. Going to Twitter. Okay, there it goes. Here we go. We're posting. Everything is posted. There we go. And there we go. I think that's it. I think we are good to go. So, awesome. Happy Saturday, everyone. So glad you're here. I see people are already here hanging out. Awesome. Hello to whoever you are from wherever you are. All right. So, good afternoon, everyone. This is UnShrink Me, and I am Dr. Patrick Lockwood. Technically, for the purposes of this podcast, I'm just Patrick. Please don't sue me, etc., etc., but welcome, everyone. This is a weekly podcast, if you are brand new, called UnShrink Me, and the focus of this weekly podcast is just to help create more informed consumers of mental health services everywhere. Whether it's psychiatry services where you potentially get meds and other medical interventions, psychotherapy services where you do talk therapy or behavioral therapy or something else, or anything like that. And today's episode is going to be a little different than normal because normally what I will do is I'll pull up, tweets and things like that are popular and trending that relate to mental health and things like that, and psychology and the science of psychotherapy, etc. And I critique them and I discuss the challenges associated with them. But today's podcast is going to be a little different. I feel like, the last handful of episodes have been very critical and reasonably critical because I don't think I'm wrong necessarily about my approach to any of the topics in the past 4 or 5 podcasts. However, what I'd like to do today is have more of an invitational discussion because what I believe is not happening well online in particular is people are not inviting each other to the conversation. And so today's podcast, I'm not really going to pick on anybody or critique any, posters or whatever. I really want to just explain why I'm here, why I've even chosen to do this when I'm kind of busy in real life doing other things as a professor and a clinical psychologist, because many of the earlier podcasts were on a different platform and they haven't saved, so you don't have access to them. So you'll see on my YouTube channel, if you please like, share, and subscribe. The Psychology Checkup is the name of my YouTube channel. But what you'll see is that a number of them are missing from, the beginning of this because they were on a different platform when I was trying to stream elsewhere. And so I explained early on why I'm doing this, and I never really got a chance to do that again. So I'd like to do that today and explain what the goal really is of this podcast, number one. But number two, an invitation to the conversation around therapy culture, mental health culture, the science of psychology, and things like that. Because I don't want this podcast to be purely criticism. It would be completely easy, unfortunately, to look on Instagram, to look on Twitter, and God help us all, to look on Reddit and find just a bunch of drivel and a bunch of nonsense that is worth critiquing and getting all upset about. And so I can do that endlessly. But what's missing is the positive aspect of this, the good in psychotherapy culture and the good in mental health culture, and why I'm even doing this in the first place, because there's something good to protect. There's something good to help people. And so this is, going to be more of an invitation to the conversation kind of podcast and an explanation of why I'm here. So again, if you're brand new, please like, share, and subscribe. Please help me get the word out about this podcast so that more people can be more appropriately educated about what potentially could be helpful to them, because that's my goal. My goal is to create whatever information is possible that will encourage people to take their mental health into their own hands, number one, but number two, be more informed consumers, critical consumers. So that's the spirit of this, and I'm going to create an invitation here throughout today. As always, I am not, NOT, not sponsored by Celsius, but Celsius is awesome. Or at least I like it, whatever. And it helps me, and it's good energy, and theoretically not hurting me. All right, so awesome to be here. So glad I get to do this today because I was in supervision with one of my interns. So for those of you who don't know who I am, let me explain a little bit about my background first. And I'll explain this story from my supervision experience earlier this week, so you can kind of get a better idea of why I'm doing this in the first place, because in a technical sense, I really don't need to be doing this. I could be doing anything right now. But I want to do this because I think I can help. So if you don't know who I am a licensed clinical psychologist in the state of California, which means that I've completed my doctorate degree. I did a dissertation, did some research, and did a pre-doc internship, a post-doc internship, and have been in California working as a psychologist formally for the last 9 years, I think. 9? Yeah. And before that, I worked in the industry. So in total, I have about 15 years in the treatment industry. So when I say the treatment industry, my experience has been, even, right when I graduated undergrad, my first job was to go work in a state-funded, federally funded rehab in central Missouri. So I didn't even have a degree or anything, but I got my nursing credential and was kind of like a helper, like a tech and a nurse. So I passed meds, and I did a bunch of therapeutic support things for my very first job at the ripe old age of 19 and 20. So for basically 15, 16 years, I've been in the industry at some level as a support staff, as a tech, as a level 1 nurse in Missouri back in the day, as an intern, as a student, as a psychologist licensed, as a supervisor, as a clinical director, as a COO. I've held so many roles in the industry, and I've seen every layer of at least the intensive, residential, outpatient, detox treatment industry for substance use and severe mental illness. And so a lot of what I say when I talk about this podcast, a lot of my criticism comes from this 15, 16 years of experience of directly addressing patients from whatever background, from all cultures, all gender experiences, all sexualities, and pretty much all ages. I didn't really work with young kids during any of my training, I think the youngest person I've worked with professionally is like 10 or 11. So I haven't worked with kids, but I've worked with, pre-adolescents, adolescents up to like elderly folks. So my experience is kind of all over the map, but the majority of it is with the very severely ill folks that are in like a residential treatment center, a detox facility, or an intensive outpatient program. So I've kind of worked mostly on the more severe end of the spectrum. I don't have decades in private practice like a lot of people with my degree. Most of my experience is working with very, very unwell people. And that has some ups and downs. It's a convenient sample because most clinicians, of whatever degree level, do not work with the acutely severely ill. Most people work with the moderately ill, if that framing makes sense, or they work with less ill people. Sometimes they even work with what I've called in this podcast the so-called worried well, where technically speaking, they wouldn't really meet a lot of criteria for a disorder. Maybe you can kind of shoehorn in the diagnosis, but they're struggling with regular life stress and regular life difficulties and phase of life issues that are like kind of diagnosable, but not really. And so my experience is very different than the average person who does therapy, etc., or even like coaching, which is, I have so much to say about that that's critical, but what I will say is, like, those people are also working with a diverse group of people, and I guess they serve some role in the ecosystem. So that's my background. My background is clinical psychology, and most of the research and training I've done is with people who are very ill. So when I say very ill, I mean diagnosable with a condition from the DSM-5-TR, published by the American Psychiatric Association, and diagnosable with a more severe version of one of those conditions. So more severe PTSD, more severe bipolar disorder, major depressive disorder, personality disorders. Substance use disorders has probably been the majority of my life, but most people I've diagnosed and treated with a substance use disorder usually have at least one legitimate co-occurring condition, and sometimes inappropriately diagnosed co-occurring conditions by other people before me. So I've worked with very difficult to treat people for the majority of my career, and purposely so. I didn't go into graduate psychology to do boring things or to not be challenged. I'm the kind of person that likes a challenge. And so it's unsurprising that I've chosen to work with more challenging patients, which is a personal choice and a personality difference on my part. So that's who I am. I'm a licensed clinical psychologist. On this podcast, I'm just trying to give my personal opinion, but you can't help but bring the professional into it. But that's all the data that's in my head. So I have the data of 15 plus years of working with people from different backgrounds and as a different kind of professional at different degree levels, etc. But I also have just lived and breathed the research on severe mental illness, substance use disorders, gender dysphoria, personality pathology for pretty much the entirety of my life. So I was reading the research about these things even in high school because I've always been kind of a nerd and I've always been kind of curious. So I've spent a long time kind of looking at the academic and scientific view of these things, but 15, 16 years of the professional hands-on experience version of this. I've also been a clinical supervisor, where I supervise interns of different degree levels, doctorate level interns or master's level interns or KDACs or counselors. So I've got years of supervising people too under my belt. That's part of my life. I also do a lot of consulting in my life. So I help small businesses become more profitable. I help executives not burn themselves out and burn their staff out. I help people resolve personality differences in their staffing problems and get people in the right job. And so I've done a lot of different things, both before graduate school and since graduate school. And that is all that I bring to the table. And because of that, I feel very comfortable commenting on personality differences and trauma and substance use and general incongruence between normative society. So that is my background. So like step 2 of this conversation, as I said earlier, is this conversation I had with one of my supervisees. So I'm just now leaving a treatment center full time and just becoming a consultant for that program. But I had this really great conversation. And I think it was really great, not because I'm amazing or something, or they're amazing. I think they're great, but I think it was great because it speaks to the problem that I'm trying to address here with this podcast. So unashamedly, when I was having a conversation with the supervisee, we were talking about a challenging colleague dynamic. And, in the industry that I've worked in for the last 10 plus years or 15 years, it's not weird to have challenging relationships with colleagues because there's a lot of different types of people who work in therapy land, the world's worst theme park, and the rehab industry in particular. So you've got some people who are very passive and people pleasing. You got some people who are big and boisterous. You got some people who have unresolved trauma. You got some people who are actively using drugs. You've got so many different varieties of people who work in these programs, and that's all normal. And then you got people who are aware of their issues and trying to get better and trying to improve and grow as people, which is awesome too. Like, one of the reasons I love what I do is because I get to be a part of the journey of not only my patients getting better, but my staff growing as people. And that's why I love supervising, because I get to help people grow and see that they're capable of more than they think. They're smarter than they think they are. I get to help them see what they can't see in themselves, right? And so I was having this conversation with my supervisee earlier this week, and without talking about anything specific, it was clear to me that we all, hello Willow, back there, it was clear to me that literally speaking, it's kind of normal for people to struggle and not be okay in the industry. And I don't want this to come off as holier than thou. Like, the spirit of this is not I'm better than anybody kind of thing, because I'm clearly not. If you see my Twitter, it's very obvious that I'm not. In fact, I want to retweet one thing right now. Okay. So a gentleman, I think, named Kale Zeldin at KaleZelden, posted a tweet about 5 days ago, and he said, his tweet was, "Our therapy culture is inherently and catastrophically unwise." So there's two important modifiers he added to his tweet. He said, "Our therapy culture," which I don't know quite what that means, but he said, "Our therapy culture is inherently and catastrophically unwise." And so I told you all that this is supposed to be an invitation, and it is. And so I'll get there. I'm getting there. Just bear with me for a little bit. So I do have some agreement. I do agree, I think, with Kale. And what I agree about is that there are some facets of therapy culture, which hasn't been defined yet, but I will, that are inherently unwise. And there are other facets of therapy culture that are catastrophically unwise. So first, let me define therapy culture using my terms. And then let me walk out what I think is either inherently unwise or catastrophically unwise, but why I'm optimistic. So I would say that there's two types of therapy culture. So there's therapy culture writ large. There's all the influencers on Instagram. There's people like myself. There's YouTubers, podcasters. There's public speakers, coaches. There's people of all backgrounds who are just trying to get information out to the world about mental health. And I would call that therapy culture. But then there's a second layer to this, which is, Naomi Best, I think is her name. Let me see if I got it right. I probably didn't, but there's a grad student who's just getting kicked out of school because of her discussion. Yeah, Naomi Best at Naomi Epps, EPPS, Best, BEST. Then there's graduate psychology, clinical psychology, and what you learn in graduate school, right? And there's that therapy culture. So there's therapy influencer education culture, online world, but then there's in graduate school therapy culture. So I think therapy influencer culture is inherently unwise because you have a bunch of people, including myself sometimes, who are speaking in a very confident way, a very, very confident way about things that they can't possibly be confident about, right? So there's so many people on Instagram and Twitter like myself and YouTube like myself. So I keep pointing out myself because I'm trying to say I'm just as guilty as everybody else. I am not magically special or so brilliant or wise or whatever that I alone know exactly what is correct or true. I am humble enough to admit that there's things I don't know and I have my biases and my baggage. Okay? So therapy culture writ large, the big educational, informational therapy culture that's just putting out content like myself, is inherently unwise because the incentive system is get as many clicks and likes as possible, all of which is normal, fine. And it's not, there's not an incentive structure for being clear and precise and pulling concepts apart. Very few people in therapy influencer culture are really trying to pull things apart and talk about how complicated things are. That's not very incentivized, right? So there are big podcasters who sort of do this sometimes. So one of my favorites is one of my friends actually named Xavier Bonilla. And so Xavier has a podcast called Converging Dialogues, which I encourage you to find on Substack, and just subscribe, all that stuff. Xavier's great, and he's smart. He's a psychologist, and he has these amazingly cool conversations with academics inside and outside of psychology. So he'll talk to sociologists and historians and everybody. He's got this wide-ranging podcast. And what Xavier does extremely well is he tries to pull things apart and asks very granular questions. Because Xavier, like many people who I know are psychologists, understand this very complicated multivariate fallacy, univariate fallacy dichotomy that people get stuck in. So sometimes people in science oversimplify things because they're trying to get an idea published or whatever it is, whatever. Sometimes people overcomplicate things. And I think Xavier does an excellent job of balancing that by sticking to kind of what we can know, but also asking granular questions to see if it maybe is more complicated than we originally thought. And that's a tough thing to sell because most people want sound bites. They want me to get crazy and burp and do crazy stuff so that I can be interesting and enjoyable. And I'm all about that because I think that's part of me too. But what's missing in therapy influencer culture is more of what Xavier does. He's an excellent person at developing a nuanced, complicated discussion around what actually is happening right now. What does the literature actually say? What do you really mean by working memory? How does that pull apart? And so in that way, therapy culture is inherently unwise, right? Because mental health influencers of all kinds take the simplest possible approach to very complicated things to get clicks, to get people to align with what they think. Like everything is trauma. Trauma. Like, no, it's not. And some of the things that you're calling trauma actually aren't trauma. And some of the things that you're not calling trauma are actually trauma. And so it's like, there's a lot of people who've never thought seriously about these topics who have a pretty big microphone And that's normal. It's not weird because they're catchy or attractive or funny. And great, God bless them. I hope they succeed and help people. But what's catastrophically unwise is actually what happens in graduate psychology. So not therapy culture writ large, but therapy culture in the profession-specific way. So in graduate psychology, and I'm a professor in graduate psychology, so I can speak to this from my experience for the last 8 years. The unwise thing that we sometimes see, not all the time, because I think my program does an excellent job of this, not just for me, but a bunch of my colleagues that I really like. But what's unwise in graduate psychology, that's catastrophically unwise, is two things are not talked about enough. And I spoke about this on another podcast last week. So one thing that's not emphasized enough in most graduate programs is the self of the therapist. And I'll say more about this in a little bit because there's also the political version of this, which I think is interesting and useful in a way that people don't see. So clinicians are people. We are not robots who are pill dispensers or advice dispensers. We are people with biases, with baggage, with culture, with personality differences, sometimes personality pathology. And because we are people, that's what makes therapy appealing, because you're having a relational experience on purpose for a specific shared goal. Whereas most of our relational experiences as regular people are not super purposeful. Generally, they're like, yes, I want to go work out with you, or yes, I want to go to have a date with you, but there's not a lot of like rigid control and structure and boundaries in a frame, to use a psychodynamic word. So that's one of the things that's super appealing about therapy. But in graduate school, if you're not teaching therapists to pay attention to who they are and why they're reacting the way that they're reacting, because you can choose any intervention and they all work pretty well. ACT works pretty good. CBT works pretty good. DBT works pretty good. Psychodynamic therapies work pretty good, like IPT. A lot of these things work pretty good. But the magic of therapy that you can't do with AI therapy or computerized CBT is the person, is the relationship. There's something appealing about the person you're sitting across from. And that is what is undervalued in a lot of graduate psychology. Now, to be fair, there's a lot to teach people. People getting a master's degree have to learn a lot of stuff to become LPCCs or MFTs or MSWs. So there's just a lot of info they have to learn, right? And I think there would be an ideal world where like all these programs were 3 years and not 2 years or something like that. But that's one problem. That's catastrophic because, when you're not a very healthy person, as many clinicians in graduate school aren't, and that's okay, that's why they're there in the first place, then you're missing important clinical experiences, important information about you that might leave you in a position to hurt the patient, or at least not help them enough. So that's one problem. A second problem that exists in graduate psychology that many of my colleagues that I'm so thrilled and privileged to work with them address is they like simple solutions and simple understandings of complicated problems. So the diagnosis, just for instance, the diagnosis of major depressive disorder is not simple. It's the same symptoms across all people, right? And some people only have 7, some people have 6, etc. when they're having a major depressive episode. And fine, fair enough. Those symptoms are fairly reliable, but are they? I mean, it's a scientific debate. They're not really, etc. But what's not reliable is the variability in human experience. Because you can be diagnosed with major depressive disorder, but you can have a shitty week or you can have a great week. And that will actually affect how you present. That doesn't mean your depression is cured just because you're feeling a little bit better or you have a little more hope or you're less suicidal, etc. That just means that diagnoses are not this black and white, concrete, thing that live on your back for the remainder of your life, that are static and don't change. So because diagnoses are not static, they're actually changing conditions. fluctuating symptoms over time and circumstance. We often struggle as clinicians to fight the urge to oversimplify something. So my challenge is the oversimplification problem in graduate psychology that exists in some programs, not all. But then there's also the countertransference not managing who you are as the professional problem. And that's why I wanted to create an invitation today. Because I agree that it's catastrophic when a clinician doesn't learn to look at who they are in graduate school, their countertransference, their bias, their culture, and take it seriously. Because if you do the lip service version of paying attention to those things I just listed, then you're pretending that you're healthier than you are, that you're smarter than you are, and that those things aren't really going to affect the patient. And I can just tell you from my 15 years of working with people at different degree levels from different roles, and just my understanding of the literature is that if the therapeutic relationship is the best predictor of outcome, then who you are matters the most from that perspective. And so that's why I wanted to create an invitation. There are so many reasons why people come into therapy. Some people who need therapy have just years and years of shame and self-hatred that they don't know what to do with. Other people have an illness like bipolar disorder and might even think they're okay. It's an egocentric illness sometimes when you're manic. And so you think pressured speech and grandiosity and flight of ideas and impulsivity is just who you are. And you kind of don't want to lose that. So there's thousands of reasons why people are distressed enough or struggling enough that they come to therapy. And there's so many different types of people. One of the beautiful things, as much as I don't like the state of California because of what they do to taxes and things like that, and how broke it makes me as a person, even though I make decent money, is because this is like one of the coolest places to be culturally because there's just so many different types of people. You know, I'm in LA proper basically, and so I have a 30 to 45 minute drive to dozens and dozens of subcultures, which where I grew up in southern Missouri, I would never have had, right? There's a reason I left Missouri because although it's quieter, simpler, and calmer, which my autistic self loves because I'm not really great with chaos and loud, the upside of being here is phenomenal. Like, there's so many different types of people you get to interact with. So many different subcultures from different regions on the planet, different belief systems. You know, it's really a cool place to be from that perspective. And so I'm immensely grateful that I got to be here. I got to do my graduate education here and start my career here formally. And so the problem that I think we can all see is there's a shortage of therapists, number one, but there's a shortage of good therapists who understand their countertransference, etc. And so what I'd like to do is I'd like to invite people in graduate school. I would like to invite people who've been licensed for 20 years to come chat on this podcast. I would like to invite people of all backgrounds, of all faiths, of all political beliefs, to come chat on this podcast and normalize something that they've never seen probably in graduate school or online, which is I'd love to have people come here and share their experience of doing the work. I'd love to have people come here and disagree with me or agree with me, whatever, and find a new way to think about something. Because what happens online in particular by the influencers, therapy culture writ large, which is inherently unwise in my opinion, is we stick to what's known. We stick to what's comfortable. And the other thing is, we stick to a very negative and pessimistic view. There's a lot, there's definitely toxic positivity for sure. I know that exists, and people are grateful for the weather and for their cold and their hangover. Like, fine. That problem exists. I don't think it's the biggest problem. I think the biggest problem in clinical psychology and graduate psychology is there's a problem of pessimism, right? So what I don't want people to think about me because of this podcast is that I'm so critical that I'm pessimistic. That's not true. I am not inherently a pessimistic person. I am not inherently a cynical person. I think that to be appropriately critical is to have an inherent optimism. I genuinely believe that the seemingly simple things I say can easily resonate with people. So like last week I said on this podcast that it's genuinely the case that there's no such thing as an inner child. And I'm extremely optimistic that when clinicians of all kinds, therapists, psychiatrists, whatever, hear that, they'll go, yeah, it kind of makes sense. His argument made sense. And now I'll do a better job of addressing this thing when it shows up with my patients. Right? And I believe that patients, if you yourself listening to this are a consumer of mental health services, you talk to a therapist, a psychiatrist, a family therapist, a coach, whatever, spiritual counselor, like this podcast is for you too. And the challenge of the concept of inner child is not to be negative. It is just to say very clearly that there's a mistaken perspective, that if we change the perspective, you'll still achieve exactly what you want to achieve, and you'll probably achieve it quicker, and you'll feel more empowered, which is what I want everyone to feel. I genuinely am an optimist. I genuinely want everyone who listens to this to feel empowered. Because with the correct knowledge, right? Not my knowledge per se, but with an understanding of yourself and an understanding of concepts that's accurate, you will feel more empowered, right? This is true across any condition. And this should be true for any kind of professional in the mental health sphere. And that's why the mental health influencers are great. Even though I criticize many of them, and I will criticize the things that I've said, it's very much the case that overall, people can help. So I want to disagree with what Kale said. I believe the person's name was Kale. That overall therapy culture is unwise and catastrophic. I don't think so. I think a lot of people have been helped by psychotherapy. I do. I genuinely believe that more people have been helped than hurt. What I also think is that so many people have wasted their time on things they didn't need to waste their time on. And that's okay. That happens. I genuinely believe, that it's not weird to think you're sicker than you are. That happens. What I want for people is I want them to hear that they're capable, because they are. So when I'm criticizing something, it's not because I want you to feel defeated. It's because I want you to think, oh, if I understood it differently, I would actually be able to do better. I would have a better life. Things would be different. Right? And just to name an easy example, maybe this will get me in trouble. I don't care. Like, I teach the human sexuality class for my university, for my program. And we had this great discussion about what the medical and psychological and psychiatric literature says about the treatment of gender dysphoria in children with hormones, puberty blockers, and surgeries. And they were shocked to see that the studies were not super high quality. And it's not to say that the interventions don't work. I used to run an LGBT rehab, And I never once said you shouldn't transition. Never once. And what I do with people when I have these discussions around these complicated topics is I say, where are you really at? What do you really need? Right? That's what I did in graduate school. That's what I did in this lecture last week, in this discussion we had as a class. We looked at the concept of where is the person really at in their development, psychologically, and with regard to their illness, gender dysphoria, and then what interventions actually appear to work based upon what literature. And that's what scientifically minded clinicians do. And this is a fairly liberal world, and I'm a fairly liberal person. However, they were saying things and having reactions that might make the conservatives happy because the literature ain't that great, right? But what we ended up coming to in our class was we can still care about people and encourage them to get the help they need and be affirming and be supportive of trans people and kids with gender dysphoria while also being clear about how shaky the literature is. Because that's the truth about a lot of things in clinical psychology, by the way. A lot of the literature ain't great. Some of it's great, some of it's not. And so the question is not whether or not these interventions are done just because there's a couple of low-quality studies. The question is, what is the idea of these interventions based on? How do they help? How do they not help? What are their consequences? That's true for CBT and DBT and hormones and puberty blockers. It's all the same stuff. And I don't mean it's like all literally the same. Obviously, hormones are different than psychotherapy, but like at the level of graduate psychology, what's beautiful, why I'm optimistic is because perfectly sane people in graduate school can take a look at any of these studies and pull them apart and go, okay, this is reasonable, this is not reasonable. These results make sense, they don't. They p-hacked, they lied with statistics, they, whatever. Like, there's so many capable people. And I've had the privilege of working with very capable people for 8 years. So I'm not cynical. And I'm not pessimistic. I believe there's room at the table for every kind of clinician. I don't like, in some cases, when people are unwell doing the job. But unfortunately, that's normal in many cases. But do I think that person should quit and leave forever? No, of course not. My hope for that person is they get better and they feel better. So this is an invitation. If you're a clinician and you're secretly struggling with drugs, you're secretly struggling with depression, you're secretly struggling with a marital issue, you're secretly struggling with a personality difference or whatever it is, or political thing, whatever it is, my invitation to you is to take that more seriously and care more about yourself and to not feel shame that you're struggling. I think one of the worst things that happens to new therapists in particular is we burn them out in graduate school because we give them so much to do and they do a bunch of unpaid labor. And then we are like, yeah, now you're all burnt out, but let's go do therapy and be fine. When in reality, most therapists are not fine. So this is an invitation to therapists of all backgrounds, clinicians, interns, psychiatrists, coaches. Take a good look at yourself and to take better care of yourself because you deserve it. You really do. And your patients will benefit from it. Your clients will benefit from it. There's just nothing better than when you're better, which helps them get better. Also, this is an invitation to patients and consumers and family members of people who need help. This invitation goes out to you too, which is, what would it look like if you took better care of yourself? Right? What would it look like? How different would your life be if you just slept a little better, or ate a little better, or had some more self-compassion? Or maybe you took your thoughts less seriously, because sometimes our thoughts just lie to us. In fact, I'm of the mindset, which I've said many times here, that most of our thinking is just propaganda. Now, that's kind of contentious, but I mean, you wouldn't listen to propaganda if it came from the federal government, if it came from Hitler, if it came from Putin, if it came whatever. So why would you listen to it in your head? Because it comes from you, it's better? No. So for me, I think there's so much we can do if you're a consumer of mental health services, or if you're the family member or a loved one of someone who's consuming mental health services, to participate in a way that gets you more of what you need. And so taking yourself more seriously doesn't mean being more miserable. It might mean having more fun. It might mean joking around more. It might mean spending more time relaxing or going to the gym or whatever. There's so many different things that people can do to be better, to have a better life, to have a better quality of life. So this is an invitation to not only be more critical of your assumptions, but less attached to what you think. Right? I want clinicians, my interns, to be super critical of their thought process when they work with people, because I want to help them protect the consumer. Just like I want the consumer, the people who consume mental health services, to try to think about, like, what would it look like to ask my therapist that question I'm afraid to ask them? Or what would it look like to, take myself more seriously, or take some ideas I have less seriously, right? Like, I'm trying to imagine a world where your life was radically worse by believing your thoughts less. I'm trying to imagine a world where your life is radically worse because you got the appropriate amount of sleep or exercise. And I've had so many conversations with families of my patients and with my interns where I'm very clear that you not taking care of yourself is part of the problem, And the same goes for me. If I'm not taking care of myself, I'm less helpful. I'm less sane. I'm less alert. I'm less sharp. So this is an invitation to join the discussion. This is an invitation to take better care of yourself. This is an invitation to be more critical of what you know isn't good for you. This is an invitation to hold on to what matters and leave what doesn't matter, right? Like, think of all the stuff that people think matters online, right? Politics and war and all this stuff, all of which is real and is real bad for the people that it's happening to. And so I'm not dismissing that. What I think is a problem is when we, people who are not actively involved in making decisions about those things and can't affect them, attach to them. So this is an invitation to non-attachment. This is an invitation to laugh more. This is an invitation to be more critical of what you think makes sense as a therapist, right? I've learned things even this year that challenged what I thought was correct, that changed my mind. And I continue to learn new things. That's why I love being a professor. And I hope that for everyone. I hope that everyone keeps learning. I hope that everyone keeps challenging what they think is true about themselves. It's always dangerous when we're rigidly adhering to an idea, right? And I want people to feel more free and more empowered. And it's really hard to feel free and empowered when you rigidly believe something about yourself, about the world, etc. Usually rigidity comes from fear, right? For the average person. So this invitation is, come join the conversation. Come tell me something I don't know. Help each other. Have that conversation with your peer that you're afraid to have. Have that discussion in graduate school that you're afraid to have if you're in graduate school. Take a chance, because I think it'll help. I have the utmost respect for anyone who tries to tell the truth and tries to live a better life, even if I disagree with the things that you think are real or make sense or matter, right? And I really hope that people see that through criticism can be encouragement if you frame it the correct way. So the frame I have here is, if that thought doesn't make sense, if this idea in psychology doesn't make sense, it's not because the people who agree that it makes sense are bad. It's because of dozens of reasons that they think that's true, like the inner child thing. And what gives me hope is that so many reasonable people go, yeah, that makes sense. And when they challenge me in a reasonable way. And you too, I hope, get the appropriate kind of challenge in your life that you need, because it will help you. And the thing that I hate about therapy culture, writ small and large, is that there's a lot of people who believe that people are fragile. And it's been my clinical experience working with, like I said earlier, very sick people, that most people are not fragile. There are rare exceptions where people have been through so much trauma, they have so much shame or so much self-hatred that they are psychologically so vulnerable and fragile that you have to be more thoughtful about how you engage with them. However, the average person, including the average person who comes to therapy, in my opinion, is actually not fragile. And I don't know if that's encouraging to treat people as if they're fragile. You can care about somebody and not believe that they're fragile, And I believe that the vast majority of people are smarter and tougher than they think they are. It's a very rare person who is psychologically extremely vulnerable. And those people need a different set of support and encouragement than the average person. So, this is an invitation. This is an invitation to do more of what matters to you, to take encouragement from whoever you can find it from. I got some encouragement earlier today, out of nowhere, not expecting it, and it was amazing. And my struggle is there's still moments when I don't think I need it, when in reality I need it too. Everybody needs it. So I hope you have people who encourage you in your life, especially if you're a clinician, especially if you're struggling with mental health issues, because you need it. And I really hope that you find mentors, you find people, you find therapists who actually get who you are, or at least try. You find people who don't assume, who don't project, because assuming and projecting happen pretty much all day. It's kind of the ordinary state of human affairs. And so as a supervisor, as a consultant, as a clinician, I try to do neither of those things as much as possible. I try to never assume if I can and not project my stuff, my feelings, my fears, whatever, onto people. And that's awkward because sometimes people expect me to do that. Sometimes people want us to be upset with them when I'm not, right? Like most of these people that I criticize, I'm not really upset with. I'm critical of what they say because sometimes I think what they say doesn't make any sense, or it's stupid, or it's counterproductive, or it hurts people. But, people are allowed to say whatever they say, just like I'm allowed to say what I say. And so this is an invitation to be more encouraging, to be more understanding, to be more critical, to be more thoughtful, but to not care about what you think. Because I can't imagine that it matters too much. So this is my invitation. My invitation is to participate more, to show up more, to do more. And if you're a therapist watching this, or a clinician of any kind, my invitation is to come hang out and chat and to share your opinion on any of these topics at any time. If you're a patient, a consumer, a family member, a loved one, this is an invitation to treat yourself with the care that you deserve and to take better care of yourselves and to attach less to what you think should be. Because it's hard to know what should be. It really is. Finally, I think I want to invite everyone to think of themselves as collaborators. There's a very oppositional world. The news media, social media, there's a lot of oppositional language and discourse. And I think one of the worst things that I've done in this podcast is speak and sound oppositional. And that's not how I want it to sound. So the reason I'm kind of doing this podcast today, this invitational podcast, is to clarify that I am nobody's enemy. Even if you hate me, I'm not your enemy. You can hate me all you want, and I'm still going to try to work with you and support you if you want. My goal is not to be a guru. My goal is to be a regular person who happens to know some stuff and things, who's kind of effective at certain things like being a professor, being a consultant, being a psychologist, whatever. But I'm still a regular person. I'm very fallible. I make mistakes. And I'm sitting here saying, I think it's kind of a mistake that I sound oppositional. And I sound so harsh. That's not what this is. This whole podcast is optimistic. It's critical, but it's optimistic. It's critical and optimistic. It's hopeful because I believe people are capable. I don't think I'm saying radically profound things. I really don't. I think I'm saying simple things that either are taken for granted or we're afraid to talk about. And I'm not afraid to talk about them. So that is the spirit of this podcast. So please like, share, and subscribe to this podcast if you think either you or someone you know can be helped by having a more critical look at what they're doing. I'm here to critique the industry because very few people in my profession do. Because the industry needs more accountability. State licensing boards do not go far enough. State licensing boards can sometimes censure psychologists and therapists, but very few people are actively having rational discussions that are not about their personal baggage. There's Abigail Schreier, who critiqued therapy and wrote a book called Bad Therapy. That's about her personal baggage. That's not about her understanding of how therapy works or clinical psychology research works. It's a political book. And so what I want is appropriate critique. And that's why I started this podcast. And the goal is to create reasonable, appropriate critiques that allow you to be a more informed consumer, to make better choices with your therapist if you have one, etc. And importantly, so that you feel more empowered. Because there is a power differential in therapy. And many therapists, sometimes unintentionally, sometimes because of their own issues, walk into the guru role where they know all things and they believe what they say makes perfect sense and they're the most empathic or whatever. And we are not gurus. We are professionals who have a specific professional role, who are trying to treat specific diagnosable conditions. We are not here to fix everything in your life. So when I talk about sleep's good for you, get enough sleep, etc., that's not going to fix your mental health. It's not going to fix your life. It might make it a little bit better, but it's not going to fix things. That's the wrong attitude and the wrong perspective, in my opinion. It's just something that doesn't get said enough. That's all. So for me, I'm critical and hopeful, critical and optimistic, because the things that I'm saying, when my interns do these things and take my feedback and we have good discussions and I learn something and they learn something, the patients get better. Things get better. And that is what I want for everyone, is to have the experience of looking at things differently, being appropriately critical of your motivations, my motivations, etc., and go, okay, what's really happening right now, right? And am I showing up honestly? Am I getting what I need out of this experience or not, right? Because many patients are afraid to speak up to their therapist. They're afraid to say, I didn't like it when you said that. They're afraid to say, I was hurt by that thing you did, etc. And you need to, right? So there's so many things to be critical of for the purpose of creating a better mental health culture. That's why I do this. And I am optimistic. And I'm very, very optimistic because what I see, and I said this to Naomi Best on Twitter earlier this week, is I see so many great colleagues. There's so many people at my university that I think are awesome. Legitimately. They're really good at what they do. They're very scientifically minded. They understand philosophy of science. They're great at stats. And they know how to teach and mentor clinicians. So they're like exactly what I would hope for as a professor of graduate psychology. So I'm a really lucky man. And I know it's not just my university. I know there's tons of people all over the country who do really good work as professors of graduate psychology, who teach future therapists of every degree level. And I don't have a lot of firsthand knowledge of schools of psychiatry, but I know it's not some disaster land. So take heart. If you think, culture war, it's all going to hell, that's not true. Life is better than it's ever been for a lot of people, especially here in the United States. And I think things are going to get better and better and better, especially when it comes to therapy land. So please do not see my criticism as pessimism, because it's certainly not. It's optimistic. It's hopeful. I'm hopeful that when people hear things, it changes their mind and they show up a little differently. And that's the goal. That's the game. Okay? So thank you all for showing up and watching, commenting. It's a great Saturday. I'm so grateful to be here. Please like, share, and subscribe if you think this is helpful or could help someone or inspire someone. You're capable. You really are. And I had people telling me that, so I want to share that and give that back. As always, I like to end this podcast with a dad joke, and so without further delay, here we go. I once had this patient. She was a musician. Really interesting person. Really smart lady who was really struggling with social anxiety disorder. Happens. Sometimes performers struggle with social anxiety. And she was going on a series of dates because she had just ended a relationship prior to coming to therapy and all this stuff. And, she'd been with the same person for about 6 different dates, about 6 or 7 weeks. And she was telling me that they were like really getting along, and they had like this great night. They went to a concert together, a band they both liked. And they came home and they had like the wildest, nastiest sex. It was great. It was super loud sex. And then when she woke up the next day and, texted like, hey, that was great. Look forward to seeing you, da-da-da-da. Radio silence. So she was ghosted by this dude she was seeing. And she was mortified because it's like things were going so well. We just went to a concert together. We had great sex. Like, what happened? And she was telling me the story. And at the end of it, she said, well, I guess, I don't know. I guess we'll see if he reaches out. And she asked me, do you think it's over? I'm like, I can't really know that because I'm a psychologist. Can't know if something is over. And she said, well, what do you think I should take away from this relationship? And I said, I honestly don't know what you should take away from this experience, but at least it ended on a high note. Have a good day. Take care of yourself.